Hi, how are you? How can I help you?
I'm here to pick up my prescription.
Okay, and the name is?
Emily Reynolds.
Hi, Emily. I'm Melissa. I'm the pharmacist who filled your prescription. How are you today?
I'm okay, I guess.
Okay. Do you mind taking a few moments to go over your new medication?
Is it gonna take long? My sister's waiting for me in the car.
Okay, about 5 to 8 minutes, just to make sure that you get the most out of your medication.
Okay,
All right, thank you. Have a seat here.
thank you.
All right, so just to start off real quick, we're going to go over some information, make sure it's updated. Your address still 1437 Cashier's Court?
Yes.
All right, your phone number 305-726-2451.
Yeah.
And I see you have a sulfur allergy. Has anything changed?
No.
No. And alcohol consumption still on weekends occasionally?
Yeah, sometimes.
Sometimes? Okay. And smoking? Do you smoke at all?
No, never.
All right. And I see you have prescriptions filled here for Nuvaring, Maxalt, and folic acid. Do you have any other prescription medications that you take?
No, that's it.
All right. And do you have any problems with those?
No, they seem to work fine.
Okay. Any over-the-counter medicines, any herbal products you take?
Nothing.
Anything for headache or body aches or?
Well, sometimes I take Midol. Also, if I have a migraine and my Maxalt doesn't work, I'll take some aspirin.
Okay, so Midol and aspirin. All right, here I have your medicine. It's Keppra is the brand name, 500 milligrams. Your insurance covers the generic, which is levetiracetam. You want to store this in a cool, dry place. Did your doctor go over what this is for?
Yeah, he told me it was to keep me from passing out for my brain tumor.
Okay, that's right. This is an anti-seizure medicine. So used optimally, it will keep you from having a seizure or passing out like you did.
Okay.
All right. Did he tell you how to take the medicine?
He just said twice a day.
Twice a day? Okay, that's right. You want to take this in the morning and the evening. You can take it with food or without food. Some people find it easier if you take it with breakfast and dinner, so they remember to take it. Do you know what to do if you miss a dose?
No, not really.
Okay, if you miss a dose and it's still close to the dose you missed, you can go ahead and take it. But if it's closer or later in the day, you just want to skip that dose completely and then just start over with the next dose. Does that make sense?
Yeah.
Okay. I'm going to go over, this is what the tablets look like. They're about the size of a large vitamin. Do you have any problems taking tablets?
No, not really.
Okay. If you do have a problem taking this, you don't want to crush or chew it. That will make it less effective. You'll talk to your doctor about it, and he'll see if there's another formulation or another medication that can be replaced.
Okay.
Another thing to note about this is you don't want to take this with alcohol. That can make side effects, which I'm going to go over a little bit worse. It could induce a seizure. Is that okay? You have a problem? Or?
Yeah, I can avoid the alcohol.
Okay. And your doctor made a note in your prescription to avoid caffeine. Did he talk to you about that?
Yeah, he said that the caffeine could make me have a seizure.
Okay, right. It could increase your risk of having a seizure if you drink a lot of caffeine. So sodas, coffee, and another thing is you may want to find an alternative for Midol if you're experiencing monthly symptoms.
Why can't I take the Midol?
Some formulations have caffeine in it. It's to help bloating, relieve the bloating and excess water. So
Okay.
we'll just look at we'll just look at the package labeling and make sure there's no caffeine in it. So
Okay.
okay. And what did your neurologist tell you to expect from this?
Just sleepiness.
Okay, that is one of the more common side effects. Sleepiness, weakness, dizziness. If you feel any of those, you want to lie down or sit down because you don't want to risk falling down. Side effects should improve the longer you're on as your body adjusts to it. If they're really severe or they worsen, then you want to contact your doctor and see what's going on.
Okay.
With that. And did he go over what to watch out for a report to him?
Well, he did something. He did say something about like depression and suicidal thoughts.
Okay, although rare, anti-seizure medications, all of them, have been known to cause people to have suicidal ideation. So you'll want to watch out for any depression, agitation, apathy, and report that to your doctor. Are you okay? You seem a little down.
Not really. This whole thing is just so overwhelming. I'm so worried. I've been so healthy my whole life, except for the migraines, which now they think are from the tumor, and now I have to have brain surgery and take this medication for brain surgery, and I can't go on vacation in a few weeks with my family because he doesn't know if I'll be ready to fly.
This whole situation is really overwhelming, but it's important to know that your home medical team is trying to make the best decisions for you so you can get better and be back to yourself, okay?
Well, yeah, that is making it more bearable, knowing that I have great professionals helping me through this. Also, my family's really supportive. We're actually going to spend the weekend at the beach.
Okay, great. And there are just a few more things to go over before you can spend time with your family. Important for you to know is that if you do get pregnant while on Keppra, it could cause birth defects in infants. So your doctor has prescribed folic acid for you, and if you take that every day, and if you do become pregnant, that should reduce the risk of birth defects. And also, you want to stay consistent with your birth control. Do you have any problems with that, or is it?
No, that won't be a problem for me.
Okay, good. Now, just to review, can you go over how you're going to take this medicine?
Yeah, twice a day, with breakfast and dinner if I want, and if I miss a dose and it's close to the next dose, then just skip the dose.
Okay, great. And what are some things you're going to avoid with Keppra?
Alcohol, caffeine, and avoid stopping it suddenly.
Okay. Yeah, so you don't want to stop it suddenly, otherwise it could actually cause a seizure.
Okay.
Okay? Now, there's a patient packet information that comes with it, and I also have my own guide to give to you that I made notes specific for you, that I'll give to you at the end of this. My number is at the top of the paper. Once you review it, if you forget anything or you have any questions, you can give me a call anytime. Do you have any questions or concerns right now?
No, that's it for today.
Okay, that's good. I will follow up in a week and see how you're doing, and I hope you enjoy time with your family at the beach this weekend.
Thank you.
Okay.